This is Connie Kubiak, and today I'm interviewing Irene Everson Howe on December 22nd, 2015. Irene, can you give me your full name and where and when you received your credentials?
My full name is Irene Everson Howe. I started my training with Dr. Derbyshire at Harper Hospital in 1949. I believe it was March of 1949. I had no previous knowledge of EEG, but when I applied for a job through a job finding place in Detroit, they sent me out to Harper Hospital because I'd been a nurse's aide one summer in high school. And when I was hired by Harper Hospital, they asked me if I would like to become an EEG tech. And I said, sure. And then I said, what's an EEG tech? So they sent me up to Dr. Derbyshire, and I was hired. And I stepped into a career that I just loved my entire life. I was just so happy in that field.
Can you tell me when you received your ABRT registry?
I became a registered EEG tech somewhere in the 1970s, and I can't remember the exact date. Okay. I think my number was 1409 or something like that, but I'm not sure.
And how long have you been retired? Where was your last place of employment?
The last place I worked was at Humana Hospital in Westminster, California. The hospital was sold, and and I retired at that time because I was also getting married to James Howe. So the timing was excellent. And that would have been, I married him in 93, and I think that I finished at Humana in 92.
Okay.
Or early 93, so.
Now, you told me that you were hired pretty much green with no experience, but
absolutely.
But what kept you in EEG and diagnostics? What was the draw for you?
Oh, I was fascinated by it. It was the most interesting thing I had ever done. I just loved it. And Dr. Derbyshire was wonderful. He sat with us when he was reading the EEGs. He sat with his techs and talked about everything that he was seeing and reporting on so that we would learn. And one of the funny stories, if you want to hear that, is that we didn't use the 1020 system back then. That was much later. So we measured our heads, the patient's heads, and we did do it by measurement. And then the patient I was having, of course, we had them open their eyes and close their eyes and that kind of thing during the test. And I kept seeing these strange little waves coming right out of the central top of the head. And I couldn't imagine what they were. So I was really eager to be with Dr. Derbyshire when he read it, and I put a lot of extra electrodes on and everything. And so when he read it and he got through with it, and he looked at me and he said, you did a wonderful job of localizing sleep spindles.
But that's what helped you learn, right?
Oh, you bet. You bet, yes.
At the time when you were starting your career, was this a popular specialty that you knew of? Did you know of anybody else, either in Detroit or Michigan or in the area, that was performing these?
Receiving Hospital was opening an EEG department while I was working for Dr. Derbyshire. And this was, I think, his job in life was to train young people to go out into the field. And for many years, he was the only one who knew how to read them. When the Michigan Epilepsy Center wanted to open an EEG department, my husband used to come in and pick me up after work. I was married to Dick Everson by then. And he used to pick me up after work, and we'd go do things and stuff. And he got interested just from hanging out. And Dr. Derbyshire trained him, and he went over to the Michigan Epilepsy Center and became their tech while he was going to college. In those days, the EEG room had to be shielded with chicken wire or something, and Dick actually built the little cage that the EEG machine would go in and the patient. So then in 1951, he and Dr. Derbyshire put their heads together with the Epilepsy Center because they wanted to try getting EEGs out to people in the Upper Peninsula because there was nobody up there doing them. So Dick learned to drive a semi-truck, and they loaded the EEG machine, and Dick and Dr. Derbyshire took it up to Flint for a dry run and checked it out, and it worked fine. Everything worked fine. the Epilepsy Center made arrangements for us to be in the small towns in the Upper Peninsula, and usually we hooked up to a school because it was summertime, and we could park in the parking lot at the school and plug in the machine, and we stayed in the back half of the semi for a couple of nights, and then about every third night we went to a motel so we could get cleaned up and stuff. But we ran the EEGs in the back part of the semi truck, and once a week Dick would take the week's EEGs in the front part of the truck. He hitched it and drove down to Detroit and brought them to Dr. Derbyshire. So we did that for 2 summers, and it was fun and so interesting.
Oh, and I'm sure the people appreciated, because I know it's now it's quite a drive to go from the Upper Peninsula to Detroit. I couldn't imagine back then.
Yes, this was before the bridge.
Correct. Other than Dr. Derbyshire, who were your other early mentors? Anyone else that you worked with?
No, I got most of what I know in EEG from him.
From him?
He was a wonderful man, just so good about teaching his text. And,
if you hadn't become an EEG technologist, what do you think you would have done?
Fashion designing.
Yeah?
Yes, I thought that I would be a fashion designer and illustrator when I took a lot of art classes in high school.
Why do you think this field took off, when and how it did?
I think it was because up until then it could be very difficult to diagnose seizures, especially petit mal. And so this was a great help for diagnostics and treatment. And Dr. Derbyshire was so forward-thinking that he and Dr. Augie Nielsen at Harper, who was a neurosurgeon, they wanted to record from the open brain, and Grass made a special electrode, that kind of a horseshoe-shaped thing with wicks hanging down, and they recorded from the open brain during surgery in those years a couple of times at least.
Did you go in with them, or was that pretty much a physician-generated?
The techs got to take turns.
Yeah.
Yes. We stayed out of the sterile area, and we were very quiet and very good. But yes, it was really, really interesting.
What equipment did you train on, and what were the limitations of it?
I trained on the old Grass 6-channel. That goes back a long ways. And we had to make sure that the battery stayed charged. There was a battery. It was a little fancier looking than a car battery, but not much different. There was a door on the lower left-hand side, and that's where the battery was. And you had to make sure that there was enough distilled water in the battery. And at the back of the machine, there were radio tubes. And every once in a while, one of those would go out. And we kept a spare supply in the little storage room in the lab. The 6L6 and the 6SL7 were the ones that kept going out on us. The rest of them seemed to be better. The wonderful thing about the Grass instrument was each channel had its own little special drawer. And if something went wrong in that area, you could call Grass on the phone, and they would ship overnight or as fast as they could get it to you, a new one. And you just unscrewed it, pulled it out, and put in the new one. And that was a great feature as far as the techs were concerned.
What other equipment have you used over the years, and could you sort of summarize the pros and cons of each?
Mostly I worked on Grass.
But I know they changed over the years. Did they get better or worse?
Oh, I thought that adding more channels, when we went from the 6-channel to the 8-channel, that was a big step. When Dr. Derbyshire and Albert Grass invented the machine, it was a little 2-channel thing that they put together. And Dr. Derbyshire still had it, and he showed it to us. It was really cute. But, yes, and over the years, Grass kept adding more channels, which was all to the good. And of course, when the 1020 system came in, and that was good. But we stirred up our own bentonite paste, and we soldered electrodes.
How did you do that soldering and all of that on the road? Did you just have a small one that you carried with you, or?
No, we just carried enough extra electrodes. Yeah.
Okay.
And when Dick went back every week, if we were getting low on electrodes, he just took some more and brought them up. So that was not a biggie.
What memories do you have of your training program?
Just that it was probably the most interesting and fascinating thing I have ever done. Dr. Derbyshire was so good about teaching everybody. And, of course, the rule is that techs never read the EEGs. And, of course, the patients always ask you, what is it like? Can you tell me about it? And I said, it shows you have a working brain.
And they still ask the same question.
I suppose they still ask that.
Yep,
well,
same question.
I know when I go in to have something, I like to ask, too. But mostly the techs can't tell you anything. So I'm patient with them.
What are the main ways that the field has changed since you started?
One of the big ones was in the 90s when they went from paper over to digital and everything was computerized. And that's just about the time I was retiring, so I didn't have to do that.
How has scientific knowledge changed the field, and what do you think were the big breakthroughs?
I have spoken with a pediatric neurologist, and he said that the change has been wonderful because it gives the reader of the EEG so much more that they can do with the EEG electronically to help them read it and understand it and do and diagnose from it.
You don't have to worry about that 3-per-second spike and wave happening while you're on the right montage, huh? What are the 2 to 3 big issues in EEG that people are working on to solve today that you're aware of?
Well, since I've been retired since '92, I'm not really sure.
Okay.
I talk to my Linda periodically, and she'll tell me some things, but so I don't know what they're working on now. I really don't.
And Linda is your daughter, is that correct?
That is correct.
And
yes,
she's also
there's a little nepotism there. I trained her, and I
yeah.
trained my cousin's daughter, and I trained my replacement when I retired from Dr. Whalen's office in Petoskey and moved back to California. So, yeah.
What are the main areas of professional discussion or disagreement today?
I'm not sure.
Okay.
I'm not sure. As I understand it, the training for the techs is nowhere near what it used to be. It's a case of put on the electrodes and plug them in, that kind of thing, and which I think is very sad because it's so much more interesting when you're doing things to get a better EEG for the doctor. I remember when I was working at Harper in the old building of Harper Hospital, no air conditioning. And in the summertime, it would get really, really warm. And we set up a bucket, a big pan with ice cubes in it and a fan to blow it on the patient so the electrodes wouldn't sweat and slide off. And we had to use filters to filter out the slow waves from the sweat artifact and stuff. You really had to know a lot about things then.
What are you most proud of in your professional life?
I think that I could tell a lot from an EEG, and that was, I think, helpful to the doctor who read it because I would make notes about what was going on with the patient when things were happening, when the paper was coming out. You know, if their breathing was changing or something, I could, with a pencil, make breathing marks, show the breathing, especially if it was change strokes or something like that. I think I was a help to the physician who was doing the reading.
Where do you see neurodiagnostics in 10 years?
I don't really know.
What is the best piece of advice that you ever received?
I received it from my grandmother, and she said, ask questions. If the answer is no, you're no worse off. Well, actually, she said, you're no worse off because she was Danish.
Is there anyone else in EEG that you feel would be beneficial for us to talk to?
Most of the people in EEG that I know that were helpful to me are gone.
Are there any prominent electroencephalographers, living or deceased, that you feel we should document?
Well, you already know about Dr. Derbyshire.
Dr. Derbyshire, yeah.
Yeah, and then the Gibbs. I think there were two of them. I think there were Mr. and Mrs. only. That was Dr. and Dr., I think.
That's correct.
And the book that they published, which was about the size of 10 seconds of EEG, and very thick of EEG patterns.
Mm-hmm.
Dr. Derbyshire had a copy of that, and believe me, that was real helpful for the techs to learn. And I remember when I was working for Dr. Whalen in Petoskey, a pattern came across from a 17-year-old kid, a young man, that I remembered that from the book, and it was called SSPE, subacute sclerosing panencephalitis. And that pattern was so graphic. And when I took it over to Dr. Whale and I handed it to him, and I said, "Is this what I think it is?" And he looked at it, and yeah, I went home and cried.
Is there anything else that you feel that you want to discuss through the interview at this point?
I don't think so, unless you have some further questions.
Nope, that would be all of our questions. If you'll hold on just a minute, I will go ahead and stop the recording, okay? So just keep holding.
Thank you.